My name is Niira Radia. I am the chairperson of Nayati Healthcare. We have a multi-super speciality hospital known as Nayati Multi-Super Speciality Hospital in Mathura. Well, I think after I gave up my corporate space, I was looking to see what I could do in this phase of my life. An important phase where I felt I needed to do something much more meaningful. I was always attached with philanthropy in the early days. For the last 20 years, I've been working on lots of programs. But this was something that was really from my heart. And after going back to, I am a strong follower of Badrinath. I went to Badrinath and I got an opportunity there where somebody asked me, why don't you do some health camps for us or start something here, because the pilgrims never got good health care when they went visiting the pilgrim centers. One thing led to another. We launched on a purely charitable basis. We had 4 mobile units placed out of Badrinath, and we did a lot of work during the tsunami. In fact, we were one of the few medical units available at hand to provide health care on the ground to the pilgrims. And one thing led to another, and you suddenly saw what emerged in front of you was the glaring reality that health care does not live in the metros, and healthcare needed to be in these regions, in these type of regions, in tier 2 and tier 3 towns. And it didn't have to be only secondary hospitals, it had to be super specialty hospitals where patients just didn't need to go to the metros anymore. Why did I choose Mathura? Actually, I come from Amritsar and we were really already headed towards Amritsar. I wanted to start where my parents came from. My brother here, my Rakhi brother, his name is Rajesh Chaturvedi. His family hails from Mathura, Dinanath Chaturvedi's son. They're based out of Bombay. They'd come here for a wedding. His wife ended up having an intestinal bleed, very, very aggressive. It was very bad. She had to be rushed to a hospital in Faridabad. There wasn't even an ambulance available in Mathura. When I met him at the hospital where he had taken his wife in Faridabad, he had his head in his hands, and his head on his head, and said, why are you going to Amritsar and why are you not coming to Mathura? And I think my journey was probably destined here from Badrinath. So from the Alaknanda, I needed to end up at the Yamuna. So Krishna's Janmabhoomi became my Karma Bhoomi. So that's how it started. I think it's been remarkable. I think it's changed a lot of us who are here. We are 750 people that in this hospital today. We have 150 doctors who have moved here, who moved with their families. Their children are here, they're schooling here now. Nobody believes that doctors would move to regions like this. I think it leaves you very humbled because when you suddenly come into a region like this and you come close to illnesses and you look at the challenges that are faced by just the common man, he could be affordable, he could be poor, or he could be from the affordable segment. But you just look at the sorry state of affairs where there was just nothing available to them. And I wondered what they did before we came here. And I think when you look at that, and when you see some of them going home, you see a small child, a 6-month-old, having a cardiac surgery with holes in his heart, or you look at a 90-year-old coming off a ventilator. You just look at life and you say, you're really humbled. I think that we believe that healthcare doesn't live in the metros is our differentiator. That we've built a hospital here, a 351-bed hospital in a tier 3. Mathura is a tier 3 market, is the differentiator. But having said that, we have world-class technology. We have the best of doctors that have come from different parts of the country. From Bangalore, we have our cardiac team, which is 21 doctors who have come from Bangalore. We have our critical care team, Dr. Mani, led by Dr. Mani, who's also our CEO, one of the leading experts in the country today on critical care. I think in global averages, we have the best today in what we call extubation of a ventilator, patients that come off a ventilator. But if you look at the sort of ventilators we've got state of the art. We've not compromised on anything. We have MRIs, we have our CT scanners. We have one of the state of the art machines on radiation oncology that's just come in for delivering. It's an Electa Versa HD. It can also do radiosurgery, and one of the best things about that is that the dose for cancer treatment is only 4 minutes. And it is obviously, it's an expensive piece of equipment, but it's the best in the world. You know, affordability in this region is a mixed bag. This is a community, this is a saving community. There is affordability in this region. There are landowners, you know, there is, but there's also poverty, as you see in any region. What you have to do is you have to balance pricing. You have to look at what the metros were charging. So you have two aspects of it. One is what they were charging for something particular, and what are your costs? What is your viability? What works for you? And how much of that profitability do you need to be sustainable to grow? And you have to be honest with yourself at that point, and you have to ask that question and say, listen, do I want a large pie of something very small, or do I want a small, something small of a very large pie? And I think that's where you're headed, because this is a demand-supply situation. So you look at your pricing, and today we're about 30 to 40% cheaper than the metros. You also examine that when people were going, when Nayati was not here, they were traveling to the metros. And that cost of traveling to the metros, when, you know, here, when somebody falls sick, it's not the family, it's not the person who's fallen sick, the entire family falls sick. They all go, you know, 5 to 7 people together. So you look at the cost, there's a financial cost, there's an emotional cost. I think the biggest challenge is awareness. People that come here don't know how sick they are. People that, you know, the saddest part is when they come and see you, you tell them, okay, you've got to get admitted, you know, you could have got admitted in a general ward. They say, no, we'll be okay, you know, we're fine, we'll go home, and because they're used to that environment. They're used to first going to a pharmacist, then they're used to going to a, sorry to use the word, a quack, and then they go to a local doctor, and then by the time they've come to you with decomposed situations, and you know, you've got to then, what you could have dealt with in a general ward, or you could have looked at them in just on judicious management, you're then suddenly having to deal with them in ICU, and the costs go up, you know. So I think it's awareness. It's about the faith that they have to have, that there is, that you know, they need to, and trust me, they're very, very sick. And if you look at the distances some of these people used to travel, even just to do a CT scan, they used to travel large distances, or just to go for a, like I said, for oncology, for radiation therapy, people travel, you know, hundreds of miles to get that done. They need to and if I look at the figures that we've got today, we've done 5,000 cases in trauma who've walked in through emergency. 5,000 in 8 months on trauma is a very large figure, which tells you that this is where a region has challenges. And I think then I look at another way. You have families that, on affordability, you know, we have to balance their need. We have to look at that the most expensive medicine is not necessarily the best medicine, and there has to be judicious management. So you have to have clinicians who think like that, you know. That's and clinicians today, and you've got to hire clinicians who can understand and empathize with that sort of a feel. Otherwise, if you look at hospitals globally, and you know, in metros, I've been, you know, to hospitals myself, where, you know, they think just the most expensive medicine is the best solution, and it's not. Amritsar, we will start excavation in Amritsar soon. It has to, you know, we're looking, it's a much larger facility, it's a 560 bed facility, and we're hoping that that will be up in the next 2 years. Mathura will also go through an expansion program. It will go through, our DPR shows that this is a 1,000 bed potential. We're not going towards the medical college phenomena, we don't want to go down that, but we're doing educational programs like you've seen today. We're doing a conference on liver disease. We're launching a liver transplant program, which is unheard of in these regions. In tier 2, tier 3, where do you see liver transplant programs, you know? So we're going ahead and launching that. So I think we are today a quaternary, we are a tertiary for sure, but with what we've got in terms of technology and doctors, we are very much a quaternary facility as well. And I think this is where healthcare is going. This is where India lives, you know? It doesn't live in the metros anymore.